Hollier, and this is the We Can Do Better podcast. I'm really excited to have Dr. Gil Mor from Wayne State here on the podcast this week as we try and just have some brief discussions about pregnancy and COVID-19, about the impact of vaccines, those kind of decisions. We've gotten a number of questions as people are concerned about their ability to conceive a child, to carry a child safely. And we thought that it was really important to bring in an expert who is dealing with all of these issues right here in Detroit and has some degree of expertise. I will readily admit that we got connected because one of the people in his department and my daughter go to daycare together. So we have a little bit of hometown advantage in that regard. But Dr. Mor, would you like to introduce yourself and tell everybody where you're from, the work that you're doing?
Absolutely. First of all, Senator, I want to thank you for inviting me to participate in this. I highly value your efforts in order to provide more information to the community. It's really, really important. I want to thank you for that. Indeed, my name is Gil Mor. I am an MD PhD. I was a professor at Yale University for more than 24 years. So you know now how old I am. And I had the pleasure that the previous dean of the medical school invited me to join Wayne State, Dr. Sobel, and to direct the MOD Center, the CS MOD Center for Human Development, who is really a treasure within the university and in Detroit. The areas of expertise that I have been working for all these years is the subject is called reproductive immunology. It may sound a little confusing, but it is a fascinating field because what we try to do is to understand what is the role of the immune system, the protector of our body during pregnancy. And as we start the conversation, I will develop more that subject and I'll give you more ideas. So to finalize my introduction, I just want to let you know that the MOD Center focus on human development from the preconception, the conception, as the more critical periods that will determine the health of the individual, generations to come. So therefore, how the importance of understanding what is happening during those periods. And now that we are confronting a major challenge that is this pandemic, it becomes extremely important that we protect the pregnant woman because then we are protecting the generations that will come to our community.
Well, I appreciate you framing it in that way as we talk about protecting pregnant women and moving them forward. So to start out with, as you talk about the reproductive system and then as it kind of intersects with immunity, that kind of first question, there are a number of people who are pregnant or are looking to be pregnant and have heard a variety of things from the internet or from someone about the efficacy or their decision-making process about getting vaccinated. Can you walk through, one, how people should be thinking about getting vaccinated if they are pregnant or if they are looking to conceive?
Yeah, that is a critical question, and I thank you for bringing the point. But let me answer that question with a little background because it's a tough one. It's a tough one, as you can imagine. So, pregnancy is an amazing condition, as all of us know. There are so many changes that are taking place in the body of the woman. It's adapting to have this host that will be for 9 months growing in the body of the mother. So there is endocrinological changes. What I mean endocrinology is hormonal changes, metabolic changes, mood changes. So there is a lot of things. But there is one change that very few people understand, and it's unique. It's the changes in the immune system of the pregnant woman. And you will ask, what is he talking about? What do you mean the changes immunological? Because you have to remember something, that when we we're a little fetus inside of the uterus of our mother, we really are a foreign body. What I mean a foreign body, because we are made of 50% of the genes from our father and only 50% of our mother. So just imagine that I take a piece of skin from you and I put it in your wife. She will reject, even if she loves you, she will reject that piece of skin. Yeah? And it's because her immune system doesn't like foreign bodies.
Right.
But your children, and I understand you have beautiful children, your children are also 50% of you. And they were inside of the mother. And they were not rejected. And we have cases that they are rejected. So the question why we were not rejected was brought by a famous transplant immunology more than 50 years ago. His name is Sir Medawar, or 60 years ago. And he proposed, because he was trying to do the first transplantation, and all his colleagues will say it's impossible to transplant organs. That doesn't exist. And Sir Medawar, very clever, he got the Nobel Prize, by the way. He said, no. There is nature who does already transplantation.
Right.
And he says, pregnancy is a transplant. So then it came the question, how do you prevent the rejection? Because we know there is a rejection. So he introduced the concept that pregnant women are immune suppressed. Because that's what we do for patients with without transplantation. Okay? That you immune suppress the organ of the immune system of the host, and then you transplant the liver, the kidney, or the heart. And only while you maintain the suppression, then the success of the transplant organ. So for all these years, this concept that the woman is weak immunologically and is an immune suppressed has been written in books and in the mind of almost everybody. So, Senator, let me tell you the first message to you and to your listeners. Although Sir Medawar got the Nobel Prize, he was a transplant immunologist. He was not an OBGYN. He didn't understand what is pregnancy.
Right.
And he didn't know about evolution. So if you think a little, if a pregnant woman will be immune suppressed, I will not be here. No one of us will be here.
Right.
We will die. Because my grandmother was working in the fields. 90% of the people, of the women in the rest of the world work on the fields. So if the woman will be immune suppressed when she's pregnant, she will die. The species will have disappeared. So my first mess, and this concept has been a major disappointment and a major problem for us, because we have put pregnant women in a box, that is, don't even expose to anything, no vaccinations, no therapies, no nothing, with the idea that they are very weak.
Right.
Totally wrong, Senator, totally wrong. A pregnant woman has the stronger immune system than ever, because that's the way we survive. That's the way the species has not disappeared.
Okay. So should a pregnant woman get vaccinated?
The simple answer, yes, absolutely yes. And I will tell you why. Let's compare the situation of infection versus vaccination. Yeah. A pregnant woman gets infected. But what I mentioned to you before, she's not going to die because of the infection. The majority of pregnant women, they do not die when they get infected. But because their immune system is so strong, they react in a very efficient, but also powerful way.
Okay.
Now, I want you to remember that anything that happens to the mother will affect or will have an impression in the fetus. Yeah.
Right.
The immunological response to the virus that is the mother is mounting to protect herself and to protect the baby is going to impact the fetus.
Mm-hmm.
We don't know what way. So let me give you an example, which we do know now. There is a study that was done in Finland. Finland is a great place to do studies because everybody looks the same.
Okay.
Number one. And number two is because they keep record of everything. Record of everything.
Yeah.
So around 79 to 82, there was a major increase in cases of schizophrenia in Finland.
Mm-hmm.
And they, as I mentioned to you, they record everything. So they wanted to know what is common between all these patients with schizophrenia.
Mm-hmm.
And what they found is that the mothers of these patients had the influenza virus when they were pregnant. There was a major a local pandemic of influenza when they were pregnant.
Mm-hmm.
The mothers did not die. The fetus did not die. They have the babies. But the immunological response that the mother mounted during the pandemic, during the influenza, the signals or the immune response cross the placenta, reach the fetus, reach the brain, and induce an abnormal development, a cognitive abnormal development, which was translated many years later in the problems of schizophrenia. Last example, Zika, because it's Zika virus, because that is something that we can see. Again, women get infected with Zika, they don't die, but they mount a very strong immune response. And now we know that the immunological response is going to affect the development of the brain, the microcephaly, that the brain is small, or we have now evidence that if the infection happened in the second or third trimester, also there is cognitive problems. So Senator, what I'm trying to tell you is, we do not know the long-term effect of COVID-19 infection during pregnancy. And the majority of the women is not killing them. They're not dying, but they get sick. And the problems associated with that immunological response, with that disease, is going to impact the development of the baby. So 10 years ago, I referred that there will be another pandemic and we will not prepare. So take a note, and let's see, maybe in 5 years or 10 years, we will be finding cognitive problems, respiratory problems in the children born from COVID-infected mothers.
Well, that is that would be a scary proposition, but I think that the point that you're making there is the impacts of COVID-19 are more than just did someone die.
That's correct. That's correct.
And that is not the metric for which we should be counting them, because every pregnant woman who contracts COVID-19 has the potential for long-term impact on that child, that baby, and that we will be having to track those things through time. Is that correct?
Correct. Perfect. Thank you. You summarized it perfect.
Senator, my wife also went to Yale, so I have a lot of experience listening to Yale people.
Fantastic. Okay, we will talk maybe later. You tell me more where to go.
Yeah.
I don't want to put you in the spot. But let me ask you, Senator. Okay, so I'm telling you that they are in the worst risk. So how we prevent that the fetus will be affected?
Got to be by vaccination. So if the mom has, so the point is, if the mom gets vaccinated, then her immune response will not be triggered to that same level, because she will not actually have the virus. That's what we're saying.
I think you went to medical school also. Perfect. So
And
if
so,
you put in the balance the risk of affecting the fetal development when you have
mhm,
slow disease versus the short inflammatory process that the vaccine does. Because again, let me expand a little that aspect. When we get the vaccine, we
mhm,
have what is called an acute, and I'll tell you what it means acute, an acute inflammatory response. Acute means 24, 48 hours that our immune system reacts. But
right.
short. So you have a spike of this reaction and then 24 hours goes down. So we feel bad for 24 hours, but the rest, then after that, we go back to normal life.
Mhm,
When there is an infection with the virus, you have the immune response that is 2 weeks, 3 weeks, or 4 weeks. That's called chronic infection.
got it.
The acute infection doesn't go to the baby.
Mhm,
The chronic infection, because it's now prolonged and it's going in the whole blood of the mother, it will reach the fetus. So put together, comparing A against B, A infection, B vaccination, I prefer to have a problem for 48 hours, but not for 4, 5, or 6 weeks.
right.
The damage that you will induce in the chronic is much higher, or the risk of inducing a damage in the chronic infection is significantly higher than if you have an immunological response only for 48 hours.
Okay, so you've made it clear for someone who is pregnant, there's no question it makes sense to get vaccinated because of the substantial impacts for the long-term safety and health of the child. As it relates to that preconception space, so someone who is thinking about getting pregnant, most of your work deals with infant mortality and those kind of things. Can you just speak to what that looks like in Detroit, in Michigan, and particularly as we lean into the work that your office is doing on, or your department is doing on Black women and infant mortality?
So unfortunately, infant mortality is very high in Detroit. Yeah.
Mm-hmm.
And we have a problem also of preterm birth in Detroit, which is one of the highest in the country. Yeah. So and again, we need to convey the correct message to our community so they understand that many of the things that are coming from the media and from outside has absolutely no scientific basis. I have many conversations trying to understand what is the benefit of this misinformation. Unfortunately, Senator, we're dealing with very strong anti-science groups. We're in 2021, where science has developed so much, where technology is amazing. And I never saw, and I'm not so young, I never seen a period in my life that we confront with so much anti-science. And maybe you can give me an explanation. That I don't have an explanation for.
It's always funny for me as people use science and technology to spout against it, but I'm in the minority, right? Like I am one of those people where I just wholeheartedly believe in experts. I'm like, oh, you spent your entire life for this one moment. I'm really gonna listen to you right now, right? Like I'm like, yep, I believe you. Yep, sure, definitely. And so in this moment, what would you be telling people who are interested in having children? Because one of the big concerns that I hear from people is they aren't getting vaccinated because they want to have children. And so in this moment where we already know that infant mortality is extremely high in the city of Detroit, can you just run down what are some of the reasons that women have preterm births, but also what are the major drivers of infant mortality?
So you are challenging me. You want me to explain a lot of things. Let's go. Let's start it slowly. Let's go for your first question, the preconcept. Right. And you know that is the major interest in NIH, the National Institute of Health. Now, looking at the preconception, we have been always focusing on what is happening in the pregnancy, a healthy pregnancy. No. Now we have evidence that some of the problems may happen in the preconception. And I'm going to do an advertising now. We're having tomorrow also a podcast here at the Mod Center about male is important in conception for the good and the bad. So the developmental problems, the complications with the baby, even preterm birth, we cannot blame only on the mother.
You probably need to say that again, because there are a lot of guys out there who don't realize that they are the problem in some of these issues.
Exactly. For centuries, we have been only blaming all the complications of the baby just to the pregnancy. Oh, you were smart. The mother did this, did not that, and the father only contributed for 1 hour. Okay, I don't know the time, but he did a short contribution, and that's it. It's not the truth. Fathers matter. And that's the subject that we're going to be discussing tomorrow in our podcast, because the health of the father has 50% contribution to the success of the pregnancy, and the health of the child and the generations. Yeah. So if a father smoke, drink, or all the good things that you want to call it, the sperm, the genes from the father who have been exposed to those environmental factors are going to impact the quality of the pregnancy and how the fetus will be dealing with the problems of the environment during the pregnancy and the mother. Yeah.
So to that point, it's really important for men to be vaccinated, so they are also not having a serious or having COVID at the moment where they contribute to the birth of the child.
Senator, you said it perfectly. Exactly that message. The science show that an inflammation in the male will affect the quality of the sperm. So if the male has COVID or had COVID, and we don't know the long-term effect of having COVID in the reproductive organs, the quality of that sperm may not be the best one if he didn't have COVID. How that is going to affect the pregnancy, we don't know, because we haven't studied. But we have other models. For example, when men are exposed to environmental factors, pollution, alcohol, we know now that will have a detrimental effect on the quality of the pregnancy, leading even to preterm birth. So it's not just what is happening in the uterus, it's how the adaptation of the paternal contribution to the maternal contribution and the sum of the two is what they determine whether that pregnancy will be successful. One more thing. During pregnancy, I started my conversation. During the pregnancy, there is a lot of mechanisms of adaptation within the mother and within the environment. But if the paternal contribution is weak or abnormal, the process of adaptation to the mother first, and then to the environment where the mother lives, is going to be affected.
Okay.
So we do have a role, and an important one, and we need to take responsibility of that. And in terms of pandemic, we need to take the responsibility. And if a man is planning to have child, he should already have been vaccinated.
Okay. So we have, from a man's side, it's very important that in that preconception space, he is doing all the things necessary to provide a safe contribution to his future child, his 50%. So if he is not, if he has COVID in that time, if he's sick, if he's got those things, it can contribute to adverse, impacts on the success of that pregnancy and the fetus. That's the takeaway here, right?
Perfect. Thank you. Greatly summarized.
Okay. Okay. And so similarly, as the mother is carrying the fetus and then ultimately into delivery, it's important that she is not having this heightened immune response because her immune system is not weak, it is too strong. And because it is too strong, it can cause negative impact to the fetus and then ultimately the child because it is, it is too strong for that child, that fetus to handle.
Correct.
Okay.
Correct.
And so as we look at these two things in concert, and we are starting to think about, how do people plan for childbirth or manage that process? What are the type of things that the data and your research are saying people should be doing versus some of the things that they hear they should be doing?
Yeah. So I heard so many things about the vaccine. Let's talk a little about the vaccine. Let's understand what is the vaccine. I like to say something before we go to the scientific aspects, a little philosophy of the vaccine. I work also with cancer, as I mentioned to you before we started this conversation. Let's go. If I have a tumor, the presence of that tumor affects me individually, and maybe those who love me, but it's limited. It's mainly myself. When I receive chemotherapy, the benefit or the suffering of chemotherapy is only to me. I am the individual who has the tumor. I am the individual who is going to suffer the treatment and so on. Pandemics or viral infections is not about the individual. It's about the community. And that's what people don't understand. The fighting against pandemics, the fighting against infections is not about me as an individual. It's me as a part of a community. Because viruses, contrary to cancer, contrary to diabetes and so on, viruses don't affect single individuals.
Right.
Viruses affect communities because they transfer from one individual to another one, because they live based on their capacity to transfer to another individual, another, and so on. Yeah. So when we want to fight against viruses and pandemics and endemics, anything that is viral infections, we need to stop thinking as individual in the individualistic approach. We need to start thinking for the benefit of the community and the long effect. Yeah.
So to that end, as you talk about it not just being the individual, there's been some discussion about the ability to pass on those antibodies if the mother is vaccinated while she's pregnant, and also some discussion about passing on antibodies due to breastfeeding. Can you just talk a little bit about
very good question.
What that is?
So when we give a vaccine to a pregnant woman, I mentioned to you, we are giving a protection to the mother and you were giving to protection to the baby. How we protect the baby? Precisely what you say, because we are transferring good antibodies from the mother into the baby. So when the baby is born, the baby will have the protection. And in the milk, it will transfer in the same thing, antibodies, and will protect the baby. So the transfer of antibodies from the mother to the baby, either during pregnancy or in the milk, is an evolutionary adaptation that has been developed in order that we survive. 50 years ago, we didn't deliver babies in sterile rooms. And you go to many countries in the world, I deliver babies in the field without the sterile conditions. And the babies survive the dirty places. Why they survive? Because the mother has been educating the fetal immune system, has been given immune cells. The mother loves the baby that it gives everything to the baby, including their immune system.
Okay.
So when the baby is born, the baby is ready to survive the dirty environment that we are. I love to see the animal, National Geographic. I was looking the other day, a National Geographic movie about elephants. And you see how the liver of the elephant comes out, and immediately the first thing is get up and start walking. If the mother didn't provide that baby elephant during the pregnancy all the required protections, in the moment that the elephant start walking in the dirty water, that elephant will catch bacteria, viruses, and it will die. When we were born in the fields, it was not sterile, it was dirty. Like it happened in many places in the world, and they don't die. No at the time of birth. And I give you one more example. HIV pandemic that many people forgot that exists. But in places in the world, like in South Asia or in Africa, there was the risk of transmission of HIV through the milk. And the World Organization, by the pressure of everybody, says, okay, stop it, breastfeeding. And you know what happened? The kids died. More than the ones who were breastfeeding.
Right.
So, transmission of immunoglobulins, antibodies, during pregnancy, and transmission of antibodies in the milk is a blessing. We shouldn't be afraid of that, because that's the way our mothers are preparing us to survive in the first year after the pregnancy. So after the first year, we have to develop our immune system. Go ahead, Senator.
So to sum that piece up, let's say, for example, perfect example, my wife gave birth in November. She was vaccinated in March. Our 7-month-old son, not old enough yet to get a coronavirus vaccine, but she, breastfeeding, has been passing along those antibodies because that is the natural process, because she is vaccinated and able to pass those along. And so for children who are still breastfeeding, who are still too young to be vaccinated, even if the mother has already given birth and not been vaccinated, by going and getting vaccinated can further protect the child, because she will pass her antibodies through the through breastfeeding. Is that correct?
Perfect. Yeah.
Okay. So as we move forward,
in addition to the protection of the baby. Go ahead.
As we move forward into the overall discussion about the vaccine, but mainly about a mother's ability to impart a successful and healthy immune system, are there just any things that mothers people who are planning to be pregnant, who are pregnant or have recently given birth should be thinking about as they think about making their immune system stronger, or stealing it, or doing any of those kind of things to accommodate for either planning to have a child, having a child, or having just had a child? What is that special sauce? What should they be doing?
Now that we're coming out of the pandemic, hopefully, so then we have to take in consideration the other aspect, because the mother and we are always exposed to viruses. I just want to say, in 2010, we have and I'll answer your question in a minute, the H1N1 pandemic in 2010. I wrote an article and I say, we need to be prepared because there will be another pandemic. Yeah. We are 2021, and we have another pandemic. What I want to tell you is, this is not the last one. Okay.
Right.
And the one is coming. I may not need to wait 10 years, maybe in 5 years. It will be shorter because we travel a lot. So it's extremely important that the concept, and I appreciate the effort that you're doing, and I hope the government will be doing more. We need to be prepared for the next pandemic. And the best pandemic is what you say. Educate the woman how to strengthen their immune system. Yeah? Educate the woman to know that if the pandemic comes, she has a tool how to protect, which is a strengthened immune system, either with the vaccine, with exercise, with good nutrition, a strengthened immune system. Don't smoke, prevent the environmental factors, air pollution and so on. anything that will induce something that we call maternal inflammation.
Mm-hmm.
We have the studies going on, and I hope when you come to visit us, I will show you what we have. We have a system where we study in mice, of course, how environmental factors induce maternal inflammation, and that maternal inflammation has a long-term effect on how the newborns will respond to vaccination, will respond to respiratory infections. Abnormal responses to vaccination are not due to the vaccine itself. It's due to an abnormal development of the fetal and the neonatal immune system. I hope I explained that. Very important. I want to repeat.
Let's go back. So if you have an abnormal reaction to the vaccine, so something that is not acute or is atypical from the normal symptoms, it is a result of something internal, something that was already there, not the vaccine. It is something that it is an issue you had previously that is being that does not react well to something.
It has been primed, if you want to call it. It has been primed already. So there are many children that they claim, oh, my child responds bad to the vaccine, or autism responds to the vaccine. There are so many things around. If you look at the numbers, there is millions of children who are vaccinated every year, and there is no problem. Mm-hmm. So if you have a child who gets the same vaccine and develops an abnormal response, it's not because of the vaccine, of the structure of the vaccine, or the construction of the vaccine. It's because the immune system of that child has been abnormally developed. And when the abnormal development occurs, preconception, the father smokes, the father alcohol, drugs, and so on, is going to have an impact on the normal development of the fetus. Or during the pregnancy, the mother smokes, the mother drinks alcohol, pollution. Okay? It will change the development of the fetal immune system. So when that baby is born, his or her immune system is not the same as the rest of the population. Yeah. So you give the same vaccine and it will respond abnormally. Or you give peanuts and it will have an allergy to the peanuts. The allergies to peanuts is not because of the peanut. There is nothing wrong with the peanut, Senator.
Oh, that's funny. So I mean, and it's funny that you mentioned peanuts specifically. It seems like there are more people who are allergic to, who are having nut allergies. Is that something? What is that piece, right? So you often hear people who are, as we go back, a little bit, anti-science saying, well, before we had all these vaccines, people weren't as allergic to peanuts. You could go on a plane and eat peanuts and do all these kind of things. What has changed that has, are nut allergies higher, or what has changed in that space?
There are multiple things that has changed in the way we live. One is that we came with this idea that because women are weaker, pregnant women are weaker, so we isolate pregnant women from everything. And second, when the child is born, we want to keep it in a sterile condition. I remember with one of my, I have a friend of mine, he delivered the baby, and I wanted to visit him at home. And said, no. Nobody comes to visit us until the baby is at least 6 or 8 months. Yeah. I don't want that the baby will expose to anything. Right. So it's the same. You want to develop strong muscles, and you say, okay, I'm going to wait until I am 50 years old, and then I start developing my muscles.
Right.
Well, it's too late. So you start developing the muscle. You take the children with 4 or 5, even early, you start making them run, exercising, and so on. It's exactly the same with the immune system. The exposure to the environment is a critical part of strengthening the immune system. Allergies to food is against nature, and it's not induced by vaccination. is induced by the way we approach the education of the immune system. Yeah, because either we isolate the child and we don't allow the immune system to exercise, or what is happening in the post-conception and the preconception. Yeah. If the mother has a maternal inflammation due to alcohol, due to cigarettes, due to pollution, all the factors that I was mentioned, those factors induce maternal inflammation, Senator. And that maternal inflammation reach the fetus and change the way that the immune system of that baby, that fetus, will respond when he or she is a baby. So it has nothing to do with the peanuts or with the vaccine. Is what is happening at the time of the pregnancy or even in the preconception.
Okay, so that kind of, I think that gives us a lot to go with. I don't want to give people too much information in too small of a time. We'll have to get you back and to talk more about some of those other pieces. But as we think about this issue of the pandemic, as we think about this issue of COVID-19 and the fact that there will be another occurrence, as people consider their role in the larger mass, as today the governor has ended all of the emergency restrictions. As people think about how they move forward in this new space, how should someone who is pregnant, nursing, in that preconception space be looking forward to protecting and strengthening their immune system from an exposure standpoint? Should they be going out and doing things? Should they still wear masks? Should they, how would you start, give them the kind of rubric on how they should think about experiencing the world over the next couple of months? People have, pretty significant concerns about things.
Absolutely, and I understand. So answering your question, the first thing is, if you are not vaccinated and you are healthy, get vaccinated. That's the first thing. Yeah. Now, if you don't want to not be vaccinated, then I'm concerned. Yeah. So then, of course, do all the protections. Wear a mask, keep the distance, all the good things that the government has indicated. Because viruses, as we know, they are transmitted by direct contact. Wash your hands. Maintain all the guidelines that the CDC has given us if you don't want to receive the vaccine. However, I encourage you, if you want to go back to normal life and we want to prevent that the virus will come back again, we need to increase the number of people vaccinated. Think not about you individually, think about the community and the damage that you can do to the generations. Remember the polio. I lived the polio. I have a friend who had polio. It's a terrible disease. But people saw that disease, and the panic of getting polio to the children led them to vaccinate. And today you don't see polio in the United States. So polio is coming back because now all this anti-vaccination campaign is stopping vaccination in many countries. And we are seeing again polio. We don't know the long-term effects as we started the conversation of COVID-19. So if you don't want for your children, think about polio. And if you don't know what is polio, go and Google it. Yeah, I lived polio. I saw the terrible disease. So we don't know how COVID is going to impact the children in the long-term effect because of the infection in the preconception or the post-conception. If you don't want to have problems in the future, please get vaccinated.
Okay. So I appreciate that. And so the thing that people should remember is, even though things are open, we're going back to some degree of normalcy, polio was eradicated, and it is on the rise because people have not stayed vigilant about keeping the immunity up to polio taking hold. And so the point is, though Americans have been able to get a significant population vaccinated, across the rest of the world, vaccination rates are still fairly low. It is not unlikely or unexpected that another variant or another thing could put us right back into this space for those who were not vaccinated.
Correct.
Okay. And so throughout this discussion, you have emphasized two things that I think I always ask all my guests, what are they doing to stay physically active? How are they maintaining their own mental health? And so as you have really emphasized the importance of being active and in shape and doing those kind of things, what are you doing personally? How do you stay active these days?
I play squash. I love squash. Because first of all, when I hit the ball, I take out all my stress. And I run and it makes me sweat like crazy. So that is, I maintain my physical activity. I don't take any pills, even as I know pills. I'm healthy because working hard, but doing a sport, and I do cycling during the summer, and I cycle also in the winter. So bicycle and squash and some swimming. That's what I do almost every day, and weekends the biking.
Well, sounds like you are staying very active. See, that's the kind of doctor I want to hear, the one who's taking their advice, saying, hey, you want to live a long, healthy life? You stay active.
He's lighting the cigarette.
Yeah.
I believe in living by example.
I appreciate that. Similarly, throughout this process, a number of folks have had trouble maintaining their mental health. It's become an increasingly prevalent part of our everyday discussions and things like that. What are some strategies that you are doing, and some that you've seen work, particularly with some of your folks who are dealing with pregnancy, as we continue to recognize that pregnancy can be isolating, and especially coming out of it during a pandemic can be hard.
Yeah, no, it has been a major problem. But the world has changed, and in many ways is not going back. And there is a blessing in everything. What we are doing this moment. I used to do it, but it was so strange because I had collaborations with countries in the world, in China and so on. So I will use the system. Believe it or not, it never passed through my head that I can do the same with my children.
Yeah.
And suddenly when the pandemic came, we started using this to all the family reunions. With my mother who lives far away, we have concerts because all the children live in different places. We have a Zoom concerts and so on. So we have discovered a tool that I would recommend. That is the only thing that you interact now with people. That is a great way to have conversations with people that you may not have the time to go and visit them. Right. So we can balance these two aspects. Yeah, we can have these conversations. Don't isolate looking only Netflix. That's not good. Look and interact with people, share your experience. As I say, I put my grandchildren to play the piano. So there is so many activities that we can organize now with this system in order to keep us connected, sharing our experience, sharing our problems, and the long distance. And now that we're opening, go to a restaurant, go to a bar, have a good glass of wine, one glass of wine.
Well, perfect. Well, Dr. Mor, thank you so much for joining us on the We Can Do Better podcast. It was great having you. Looking forward to coming over to the department and see all the great work you're doing. It's great. We really appreciate it.
Thank you for what you're doing for the community. I really appreciate that. Thank you.
Well, this has been another episode of the We Can Do Better podcast with Senator Adam Hollier. I was very excited to have Dr. Gil Mor from Wayne State here at the CS Mott department, as he talked about all of the incredible reasons that it's important to get vaccinated, as we talked about the immune response to COVID-19, and just doing your part to help make sure that this pandemic not only is in our rearview mirror, but does not come right back to us.